From the time she was a tiny infant, 4-year-old Olivia Sabin has been battling a formidable opponent: epilepsy.
Olivia was first diagnosed with epilepsy when she was about a week old after her first surgery. And then the seizures just got worse and worse. And she was constantly in and out of the hospital. And it was very difficult on all of us, very scary.
Olivia was brought to Emergikids at St. Alexius Medical Center after suffering a shunt malfunction.
Olivia's parents were referred to 2 Alexian Brothers physicians, pediatric neurosurgeon Dr. Brian Bertolio and epileptologist Dr. Abdul Mazen. It was a life-changing event for Olivia and her family.
We got involved with Dr. Bertolio and Dr. Mazen through the ER doctor at St. Alexis.
When I first met her, she has seizures 1 to 2 a week, make her even weaker on the right side of her body. And in spite of her medication, she keep having the seizure every 2 to 3 days.
I first met Olivia when she was 2 years old, and she was having some complications related to a shunt she had placed around the time of birth. And she also had frequent seizures at the time and was on multiple medications for that.
Because for Olivia, epilepsy was a stroke when she was a baby. That damaged her part of brain from the left side, causing the seizures.
Dr. Bertolio and Dr. Mazen collaborated to develop a treatment plan for Olivia.
Well, there are 4 options of treatment to treat epilepsy, the seizure disorders. One of them is the medication. The second one is the ketogenic diet. This is specific diet. We change the diet they eat, and that will help the seizure control. The third one is the VNS, the vagal nerve stimulation, which is like a pacemaker for the brain, and it help to control the seizure. The fourth one is the surgical treatment, is removal of the seizure seizure area to treat the seizure.
The first treatments that we tried were medication, and we did medication and medication and more medication, but nothing was working. She kept having seizures, and they were becoming more aggressive and more life-threatening.
As time went on, we realized that her frequent seizures may be able to be treated surgically since her medications weren't working that well for her. And Dr. Mazen and myself ordered a variety of studies to see whether she'd be a candidate for surgery.
Olivia's diagnosis and all of her medical treatments greatly affected our family. Our whole world revolved around her and what was best for her. Our life was therapies, medication, ambulances, and hospitals. And that's not a life for anybody.
After trying other options to control Olivia's seizures, Dr. Bertolio and Dr. Mazen agreed surgery was the best option.
Surgery was the best option for Olivia for a couple of reasons. First of all, the medications weren't working. She was on multiple medications and still having very frequent seizures. And second of all, she was a candidate for surgery because the vast majority of her seizures were coming from one small spot in the brain that we would be able to treat surgically.
Before having surgery, Olivia underwent extensive and sophisticated diagnostic testing and evaluation at Alexian Brothers Neurosciences Institute.
We decided to do the resection surgery because our doctors and her father and I decided it was the right choice. And we decided to do it at St. Alexis Women and Children's Medical Center because that's where her doctors were, and we trusted them.
During surgery, Olivia was put to sleep, and then we removed part of the skull to expose a large region of the brain from which we could record with electrodes with millimeter accuracy the activity of different parts of the brain and identify which part of the brain was causing the seizures and then which part of the brain served different functions for Olivia so that we could know that we can safely resect that part of the brain, and then after the resection, know that the seizure activity had stopped.
Dr. Mazen assisted Dr. Bertolio in the operating room.
My duty is to map the area and make sure the seizure coming from particular area to confirm that and pinpoint the seizure where coming from to the smallest area you can remove. My goal it was to help to remove the severe seizure coming from the left side, so she can learn, she can progress, she can go therapies, go to school, and at the same time, any other type of seizure coming from other areas of the brain, we can treat it with medications.
I think it's important to recognize that surgery for epilepsy in general is underutilized, and there are a lot of patients with seizures that could potentially be cured if they underwent the appropriate evaluation and treatment at a comprehensive epilepsy program like Alexian Brothers.
After surgery, Olivia recovered in the pediatric intensive care unit at the new Alexian Brothers Women and Children's Hospital.
Olivia did very well with surgery, and she's recovered from the surgery, and she's markedly improved, and it's great to see her each time in clinic follow-up and see how well she's doing.
She is doing so well. She's progressing in her therapies and not regressing. She's happier. She's more alert, and quite a little personality has come out of her that we've never seen before.
For the first time in her life almost, she have no seizures. And that gives them more time to spend with her outside the hospital. They have more time to spend as a group, as a family.
Dr. Bertolio and Dr. Mazen are two amazing physicians who are very unique. They are not only highly skilled and qualified physicians, but they truly care about their patients. And I am so grateful to them. They've given Olivia a chance at a much better life, and I can't thank them enough.
As much as I changed her life, she changed my life. I am so proud and honored to be in this moment and this time to help her.
I feel very grateful every time I see Olivia for having been able to play that role, and see how grateful they are for the care that they've gotten.